titled or named Lipra. And as I said, EAS National Society's program rewards more collection and support, imposing research infrastructure in Africa. And it's very important to push it because you know we have some problem in the infrastructure of research in our countries. And it will be a template for other worldwide regions. It will address the problem, which I said, which is very important, the premature atherosclerosis and acute coronary syndrome management in Africa. It is the most populated countries in Africa, and it is worthy to mention Nigeria, Egypt, Ethiopia, Uganda, Kenya, Tanzania, Republic of Congo, South Africa, Algeria. And fortunately, we have most of those countries recruiting patients now in our Lipra project for premature atherosclerosis and acute coronary syndrome events. I will do an overview of the EAS Lipra Registry, objectives of the registry, inclusion criteria, the project selection, the protocol, the data collection and registry records, and I will take all the few minutes. The first study focus, this is actually the first study focus on premature acute coronary syndrome in Africa, able to understand its prevalence, risk factors, management, in the African population. And I see a lot of African faces here. The registry fosters a collaboration between the African investigators and also the European atherosclerosis as international partners. As I mentioned, we have a great experience in such a situation in the cardiovascular quotient recruiting more than 3,000 patients from 2015 to 2015. And as I mentioned, we found unfortunately more than 51% of those patients admitted with ECS that they are developed prematurely. The objectives of the registry, we create a registry of observational studies on ECS in Africa to address data gaps in lipidology and preventive cardiology, which is very, very important. As we all know, all the world now is going to the preventive ways, and as a cardiologist, we are going to the preventive cardiology. Identify the cardiovascular risk factors of premature acute coronary syndrome in African populations, including variations of age, gender, urban versus rural location. As we all know, all researchers that came from Africa, from Western countries, European countries, and American countries, and we have lack of data from African countries. That's why we have to know, we have to learn to do much more better with our African patients. We will create international standard and tailored protocols for ACS management in Africa, and I think it is a very good opportunity when we are doing the research to going with the standard treatments and protocol for treating patients with acute coronary syndrome. And also we have to raise awareness about the cardiovascular research in Africa, improve the public health, the patient care and awareness, and also the data collection, which I think we miss a lot of it. This is the project team management. We have the great honor that Professor Ashraf Reda, the president of IAVA, is the project manager. We have also some partners from the European Society of Cardiology, European Atherosclerosis Society, and different also African countries, as I mentioned. The Lipra structure, the project management team, the Lipra executive committee, the steering committee, the national lead investigators, which I have the honor to be one of the national lead investigators, and the individual sites from different countries who also contributors. This is a very important publication in Atherosclerosis Plus. We have the honor to declare that our protocol is published in this journal in December 2024 as a cooperative effort across Africa to investigate risk factors and outcomes of premature coronary artery disease syndrome protocol for the EAS Lipid Registry in Africa named Lipra. It is very simple for men aged from 18 to 55, for women aged from 18 to 65. Patients must be diagnosed with premature acute coronary syndrome at the time of enrollment, and patients must be recruited from participating medical centers across African countries. Very simple, but very important. We have online CRF orientation sessions, 3 sessions done for all the investigators and the co-investigators to be oriented about how to use the CRF, which is also simple for recruiting patients. This is an example for the CRF, and we have the ICOM group medical recording system, which are doing very well in collecting the data and also analyzing it. Of course, we have some challenges. challenges is the research infrastructure, and I think this is a good opportunity to a fine-tuning for the infrastructure and research infrastructure in African countries. We have also some problem in the logistic issues and paperwork, but ICOM company doing very well in such issue. We have busy physician, and we overcame that with using some fellows and co-investigators to collect data with us. And of course, the financial support, as our research needs no much more money, so it is not much big problem for the financial support. As I said, we have about 10 countries now recruiting patients: Botswana, Kenya, Mozambique, Cameroon, Nigeria, Sudan, Tanzania, Ethiopia, Ghana, also Egypt. We have 43 medical centers, and as I mentioned, we have national lead investigators 15, clinical investigator 27, web investigator 22. We are doing very well since we started May 24th as regard the ethical committee approval, as regard the training session, as regard the paperwork. Improving, the infrastructure is improving. We have now, at the time I'm speaking, more than 500 patients already recruited, and we are going on to know more. We are going to know more the risk factors which are responsible for premature atherosclerosis in our African countries, and I think it is a very important step of the way, and thank you for your attention.